Hello everyone and welcome to the Health Go Live webinar series. Today's episode is brought to you by our friends at Dakadu. Just a few housekeeping items to go over. We'd like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Join us after the webinar for a Possum Dog Show brought to you by Danielle O'Neill of Team Zoom. And with that, I'll throw it over to our moderator who joins us from Forbes, Nicole Fisher.
Hello, everyone, and welcome. If I can get the panelists to go ahead and turn their cameras back on. Hi, Marcus. Hi, welcome, everyone. Okay, so to get started, before we jump in, I would like each of you to actually take just a moment and introduce yourselves, because I think it allows everyone to get to know you a little bit before we dig into the topic. Can we start with you, Mona?
Sure. Hi there. So Mona Siddiqui, I lead enterprise clinical strategy and quality for Humana. I'm both a physician and have a background in data science. Bring both to the consumer orientation that we'll be talking about today.
Thank you. Marcus, how about you?
Hi, I'm Marcus Osborne. I lead the Walmart Health business. Walmart Health is the healthcare services, health and wellness services business within the broader U.S. healthcare business for Walmart. So I help manage that side of the business. Thanks.
Thank you. Jaffrey?
Hi, I'm Jaffrey Mohammed. I'm a senior vice president and I lead the healthcare services for UST Global. We serve the providers and payers in the transformation journey.
Thank you. And Barry.
Hello, thank you, Nicole. Barry Pillay, Vice President of Dakadu Americas, working with health insurers primarily to bring them along on the digital health engagement platform side of the business.
Perfect, thank you very much. And it's a great segue, Barry, that you said engagement, because that's really what we're going to be talking about today. If 2020 has taught us anything for better or worse, it's a lot about the health industry and the landscape. And a significant takeaway from the very early days of the pandemic was that access to care was going to be more digital than ever before. And yet for years now, we've been hearing these buzzwords, and we've been talking about tele this and digital that. And so it almost seems like we're now being forced to live in that future we've talked about for a long time. So, today I wanted us to spend a lot of time talking about how do we build trust? How do we think about consumer-centric engagement? More specifically, I would say, how do you use engagement to provide such an incredible experience that you inherently build trust and loyalty? We know it has to be relevant, it has to be easy, it has to be fun, but for leaders, it's a lot more than making it fun. So let's get started. Mona, I'd actually like to come back to you and have you kind of kick us off. And what I would ask of you is to take us a big step back. I want to talk about the most important person or people in this dynamic, and that's the patient, the consumer. Who do you see out there that is doing consumer really well? Maybe talk to us a little bit about some of those, outside the industry players who do consumer well and know consumer-centric engagement better than a lot of us in healthcare do.
Yeah, that's a great question, and I think the names on the list are not going to be any surprise for people, right? And I think we talk about Amazon a fair bit, and the ways in which our expectations have been transformed by what they've been able to deliver, right? I think 20 years ago, if you had asked us what our expectations were for our shopping experience, we would not have articulated the set of things that they have been able to deliver. And I really love the fact, Nicole, that you started with this concept of trust, right? Because I think that is something we talk about a fair amount internal to our organization as well. I think one of the reasons why some of these outside players have been so effective has been that the needs that they really identify and address the needs that we might not even know that we have, or we might not even think about going to an Amazon for instance, right? I would say our sort of experience in the past few months, just to share sort of what we've learned and taking some of those lessons internally around COVID has been, you know, our members have had so many disparate needs come up, and they have not necessarily been things related to their medical conditions. They've been things that have come up like, you know, housing insecurity, or lack of access to food, or lack of transportation, things that you would not necessarily think that a payer has had all of the capabilities built in to be able to address. But that building trust, I think, has been so core to what we've wanted to do that, you know, I think taking the lessons from these industry players around what are the needs and how do we, in an agile way, develop the capabilities that we need to develop to then address what you need as the end user, and how do we do that in the most seamless way possible. I think that's really, we're probably at the early phase of that journey, but I think there's a lot that we talk about from that consumer experience trust perspective that we want to continue to build.
Mm-hmm. Yeah, and Marcus, I see you nodding along. Do you have something to add?
No, I mean, I think, you know, I guess what I would add is that I think sort of building on that, I think there's a real important point of that what we sort of have found over and over is that the industry's inclination is to constantly try to tell people what they should care about, meaning that, you know, you think about, I can't tell you how much of my life I've had to spend talking about star ratings, for example, and, you know, medication adherence and those kind of things. And like what I say is consumers don't care about medication adherence. They don't. You as a health plan care, or you as a government care, or you as a pharmacy care, but they're like, that's not, no one in America is going around thinking my biggest problem today is, am I doing enough to stay on my drug regimen, like, for example. And what we find is these kind of stories, and I think that's really important, that I think one of the key learnings is how do we begin to actually solve for the things that actually people care about from a health perspective? Because what you find is when you help solve for those problems, they begin to say, okay, you know, that's how you generate that trust. And then the things that you think they should care about, the things that you think are important, you are in a better position to say, I also think you should consider this. And I'm mindful of the story I've shared. It's a very recent one, but it was just very telling. And we had a situation in one of our Walmart health sites in Georgia where, and I won't go into the full story, but there was a grandmother who had, because of some issues with her kid and that she actually was granted custody of her two grandchildren. In the course of being granted custody, those two kids, she found out that those two kids needed health screenings and immunizations that they hadn't gotten to be able to remain in school. And so she came in and, you know, was trying to get her kids taken care of. Now, what I can tell you is this was a woman who, the amount of stress and angst that she was dealing with in her life was so immense that was obvious it was impacted. It had impacted her health. She was on a Medicare plan, and I imagine the cost of that plan was going to be significant because of the impact of the stress. But if you come in and say, well, you could try to convince her that she should be focused on her needs, and maybe she wants to sit down with, you know, would she benefit from sitting down with a behavioral health, you know, with a mental health specialist, with a counselor or therapist? Absolutely. But that wasn't her interest. Her interest was first and foremost trying to take care of the needs of her grandkids that she just got custody over. And so it was only in taking care of her grandkids' needs, and she felt like they were being taken care of and taken care of well, that anybody was in a position to say, hey, what about you? You know, what about the, you know, have you thought about this? And it was in that moment that she did engage. And so I think about that as sort of an example of where we all could learn of, it doesn't matter what you as the plan, or you as the health system, or you as the provider, or you as the whoever care about. It's what are the people you're serving care about. If you can solve for those challenges and build that trust, you're going to be more likely to drive that engagement. So I think that's absolutely, I think Mona's point, I think that's absolutely critical point. And I think something we've learned in COVID.
I absolutely love that you said solve for the things that really matter, and Mona used the word, core, like core values. So I actually want to stay there for just a second and have maybe each of you talk just a little bit about, not only sort of leadership during this time, but the cultural values within your organizations that are part of why you're here today, to talk about engagement, to talk about trust and loyalty and building brand loyalty. So I'm actually going to come to, let's see, I want to start with Barry. So Barry, talk to us just very briefly about your culture and how you're using that.
Sure. I think it's really important that cultures and at large organizations, at healthcare systems, at health plans, and really across corporate America are able to be, I'll call it empathetic in this day and age. It's a really, really strong quality that I think perhaps in the past has moved to the corner a little bit, but is really coming back to the forefront. And I think that's what both Mona and Marcus were pointing out, is it's that, we care kind of empathy that an organization can exhibit in any number of different ways to their constituents, to their employees, to their consumers, or to their clients. That really goes a long way. I want to just say, in terms of leadership, I love Wayne Gretzky, the Hall of Fame hockey player, famously said a few things that directly, I think, apply in the business world at large. And that's, he always said, I skate to where the puck is going to be next, not to where it is now. And I know nobody loves sports analogies, but I figured this one's great, because really what it is it's that transformational, visionary thinking and leadership that's so critical. And there just has to be that willingness to take both thoughtful risks and to sort of shed traditional beliefs about consumers. One example of that is really the recognition that healthcare can no longer be viewed as a transactional business, but really needs to be viewed much more as a relational business. And there's just numerous examples of that. And again, it's that empathy. It's building that strong, ongoing relationship from the first interaction with the consumer and right through their, I'll say, digital journey, but certainly their journey with you as the employer or as the company providing the goods. An example of a traditional belief that's kind of been put to rest is Medicare consumers. It's now known that they actually are far more digitally capable, and they score much higher than we used to believe. And the reality is they're actually sometimes even more digitally engaged and digitally capable than some of the younger consumers. So there's a change that's happening that is really impacting, again, that transition in our beliefs and the ability for us to move to, I'll say, where the puck is going to be rather than where it's been. Another example of, I'll call it, sort of leadership in regard to the day and age that we're in. A few years ago, Mindy Grossman, who took over as CEO of Weight Watchers, decided that the future of her company lay really much more in the broad holistic health and well-being space than it did just in weight management. And she completely reinvented the vision and strategy of the organization, even rebranding the company and kind of doubling down on digital as the best path to get there. This type of bold leadership is really what's going to drive digital health engagement forward, which ultimately will impact customer loyalty.
Excellent, thank you. And Jaffrey, what about you?
Yeah, in fact, I couldn't agree to the points that Mona, Marcus, and Barry made. Healthcare is not transactional. A person sitting to get the MRI is not there just to get the MRI. It is the holistic experience for health, mental, as well as the physical health-being that the person expects. And that is very crucial, just to think it through as the healthcare goes beyond the four walls of a delivery center. It is not that in a hospital setting that healthcare is delivered. And to point that Mona mentioned, that how to take care of their well-being, their food, their diet, and all that stuff. At the same time, build that trust and the engagement model so that you are able to help them in much broader way, because obviously what happens outside the four walls of a delivery setting has a huge impact to the health and well-being of an individual.
Yeah. And Mona or Marcus, do you have anything to add?
Go ahead, Marcus.
No, I mean, I think you hit it. I mean, I think for me, I mean, going back to kind of your original question on it, I mean, I think at least one of the things that certainly drives us, and maybe it is the orientation that we have and the industry we come from, which I think has one unique characteristic that is not as much defined in some of the other industries, which is we're in an industry that is littered with companies that I think were at one point pretty good at taking care of needs of consumers, but now no longer exist or are now sort of a shell of their former selves. And I won't sort of throw anybody that still exists under the bus, but I think we all know the kind of, you think about in electronics, the Circuit Cities and the Radio Shacks and others of the world that, you know, if you think you've purchased something from them recently, I have bad news for you. You haven't. But what I think, you know, retailers live, and I think particularly good or great retailers live in a utter state of paranoia that there's somebody out there doing a better job of taking care of people than you. And I think in some ways that that ethos that I think is very much a defining characteristic within Walmart, that I see it every day. And that, you know, that the competitive realities of dealing with, you know, Amazons or Kroger's or CVS's or Tesco's or whoever it is, that sort of desire to, like when you say it is a defining characteristic of, you know, when we say we're consumer centered, we are consumer centered because we're afraid we're going to go the way of Circuit City, right? And that the question for me, honestly, is as I'm focused on the healthcare industry, is what does it actually take for the players in the healthcare industry to have the same sort of almost paranoia, the belief that if I don't do everything I can in this moment to try to take care of the people that I serve, be it my plan members or my patients or whatever you want to call them, that I might not exist, that if I don't do it, that not only is people's health going to be harmed, but that it might not actually be in existence tomorrow. I think that is, you know, we think that's one of the actual things that maybe is missing in the industry, is that sense of you know, of something that's just driving you right now to believe you've got to do it today, because if you don't do it today, you may not be around tomorrow to be in a position to do anything about it. And so I think that particularly to the point that, you know, Barry made about Weight Watchers, I think some of the move into digital that I'm seeing is actually being driven by that, is this belief that we can, sometimes I see digital work being done for digital's sake, but sometimes it's because digital means enable us to better serve the consumer. And so I think that is, for us, that's important.
Marcus, I might just pick up on that briefly. And I think, you know, that move to digital, which has been going slowly in healthcare until COVID, and we've seen acceleration of so many things that have been kind of percolating for many years, you know, it's also been driven by the shift of more care into the home, right? Like how would we all want to age? I mean, that's something I think about every day for my role. How would we want to get more care in home and community-based settings? And digital is just such a core piece of that. It's about building a set of capabilities and showing up from an experience perspective in as seamless a way as possible. The healthcare experience, you know, is sort of littered with point solutions and things that show up as sort of a single point in time. And I think we have to, as we sort of think about how we shift and enable more of that care in home and community-based settings, also think about how digital enables us to provide a more seamless experience of care.
Yeah, that's excellent. And so building off of, I mean, what you were all for just saying here, that digital enables us to better serve the consumer, no matter where that is. So thinking about that beyond the four walls and digital, Jeffrey, you're the expert here when it comes to integrating technologies across platforms. So let's have you sort of kick us off and have a discussion about the role that interoperability and data processing can play, sort of frame how technology will help us with that consumer-centric ecosystem we're aiming for.
Sure. And just latching on to what Mona said, that this pandemic situation has really taught us something. And it has taught us that the behaviors can change rapidly. We have seen the telemedicine, which was less than 10% of the claims, jump over to over 70% of the claims in this pandemic situation. Now, there are two broader aspects of digital engagement that we have seen. One is the data side, that how to create the interoperability, which is very core of this problem. The second side is the engagement. When you talk of the data, there you need a partnership between the regulators and the private players. If you see globally, Singapore has done excellent job in terms of aggregating the data and creating a right phenotypes and right genomics and right need of the data, both the clinical as well as non-clinical, to understand the patient. Now, when you talk of the engagement, the engagement has to be personalized. For that, you need to segment the population. The way you engaged with somebody who is 65 years old vis-a-vis somebody who is 24 years old is very different. So to have the right data and also to have the right governance, which will give us the trust from the consumer to make sure that the data will be used for the right purpose, is the core component of it. And what we have seen is that some of the major players in the market have really moved very fast in terms of aggregating the data, both clinical as well as non-clinical, to form that entire ecosystem, which will help them to understand the consumer very well. Now, on the engagement side, there are a few things that we need to take care of. The first and foremost is putting the consumer right up front to take the decision, demystifying the financial aspect of healthcare, which is so broken right now, meaning that no one would know what would be the financial impact for a given procedure or a given stuff. Very easy problem to solve if the ecosystem comes together, where we can create a view where the patients are taken away from those things. And also, providing them with the right data element to take the right clinical decision. Now, people talk on the behavioral part. Behaviors are very tough to change. I think the right engagement models are the ones that work around the behavior of our consumers. And we have seen some models in which a right model has worked around the behavior of a person to get the right outcome.
Thank you. I saw all of you nodding along. Is there anything that someone wants to add to that?
Sure, I'll add. And thanks, Jeffrey. I think you're spot on. There's a global case study that Deloitte did on healthcare transformation that really recommends three approaches to a successful digital health strategy. One being a focus on prevention and well-being. The second being that interoperability of the data and the platforms that Jeffrey was discussing. And third really is the consumer engagement and empowerment side of things. At Dakadu, our health and life insurance clients are really coming to us seeking to integrate, as Mona pointed out, the numerous digital health assets that they may have built themselves or have with third-party point solutions, and really looking to aggregate that or sit it on a single interoperable platform that in turn, for their members, will make taking care of one's health relevant, easy, and actually fun. We drive up digital engagement, which then builds sort of naturally a certain level of customer loyalty. And some of the key assets that we offer to create this unified member experience on the digital health platform are things like offering an open API for exactly the purposes that Jeffrey was pointing out, predictive analytics, so you can look across the population or segments of the population and analyze risk, a health score that gives an individual as well as a health plan a view into, on a daily basis, on a real-time basis, a score of really assessing exactly where a person's health is at any given point in time. And that ability to quantify health in a single individual number for a person, and then report back to them as their lifestyle behaviors get better and better, they'll see their score going up. So it's really important to have that feedback, that constant motivation to keep going. Other assets include things like AI and machine learning, different triggers for sending messages, deep analytics capabilities, holistic health and wellness content that really is meaningful and targeted at all risk levels. And then, of course, gamification, a social component, social connectivity capabilities, and a points and reward system. These are all assets that drive participation, not just when you need to ring a bell and get your reward, but for the long term and really sustain it across a given calendar year. So by employing this type of a blueprint for a digital health platform, you can achieve very high levels of continuous engagement. We generally see between about 25 and 50% measured as what we call DAU/MAU, which is daily active users divided by monthly active users. And that's really a stickiness index that's been created by the social media companies like Facebook and Twitter to assess how often are people coming back to their site over and over again.
Thank you. As you were saying that, I was also looking over at the questions, and they're starting to come in. So I also want to remind everyone that you can submit questions. You can also upvote questions. So if you see that someone else is asking something very similar and you give it an upvote, it'll help let me know that there's a lot of people interested in this. And based on what you were just saying, Barry, I'm actually seeing a couple of questions being targeted at Marcus, going back to what you were saying. And I'll pose my own question, but sort of thinking, in the same line is, talking about all those different things. And you had mentioned paranoia. And I have to admit, as we've talked about, at the very beginning, Mona said Amazon, we talked about Apple, some of these other, sort of outside entrants into health. And until I was exposed to all that Walmart does, I never thought of Walmart as a tech giant. And yet, upon learning more, it became really obvious as such. So, what have you learned that you can tell others about, bringing that outside perspective in to health and consumer engagement? And something I'd like the group to sort of discuss, and you've each touched on a little bit, is, disparate needs. So Marcus, you, for example, live in Arkansas, right? Which is a very different experience than someone living in New York. And so, I'd like you to talk about Walmart and framing that for us, but I'd like to hear from everyone about, how to do all these things, these wonderful things we just talked about, but across really disparate populations and needs, even needs that people don't know they have.
Yeah, maybe I'd actually say that it's not that there's disparate needs across populations. I actually think there are disparate needs within the individual. In other words, the thing that makes us really interesting as humans is that we are the same until we're not, and that we're defined by what I want in this moment may not at all be what I want in 4 minutes or in 4 hours or in 4 days. And I think that's something we all intuitively understand, but then for some reason kind of at times fail to apply when we start to do design work around solutioning. And what I mean, and I think this is kind of a learning, certainly has come from retail, that I think is also influencing how we see the world from a healthcare perspective. And I think often we started to go down this path. I mean, often there is a healthy conversation, I think now finally happening around multi-channel approaches to care. So it's not just sort of care delivered in a hospital or traditional healthcare setting. Maybe it's care delivered in a retail setting. It's care delivered, as Mona mentioned, in the home. It's care delivered, as Barry mentioned, using digital or telehealth means, using AI or other things. And I think that's a really important conversation, but I'd actually argue the more important conversation is one around what is a term that we use a lot, which is just omni-channel, which says the way consumers think is they don't think in channels. They view channels as tools, and they think about the problems they're trying to solve for, and then how do I deploy the various tools I have in this toolkit to address the needs that I have. And so what I mean by that is increasingly consumers are taking multiple channels and putting them together in really interesting ways to create completely new experiences. You think about some of the challenges that arose in retail where people would go into a physical setting, a bricks and mortar store, and would go in the TV aisle and look at the various TVs and say, that's the one I like. And they'd go back home and they'd order that TV and have it shipped to their house. That is an omni-channel experience, right? You think about it, it merges a digital and the physical world in a very unique way that we all fundamentally understand, but that we often sort of miss in our design work. And so, as we think as we think about what the ultimate solutions look like, the solutions we think through that omni-channel lens. It's not about one channel versus the other, but it's actually how do those channels begin to integrate and how do they become ways in which new experiences can be created that enable consumers to engage in a more robust way. And our view of health is that the prime problem is engagement. If I can get you to engage today, if I can address there are enormous barriers that exist, cost, convenience, complexity, whatever it is that are keeping people from getting what they need today. But if I can use multiple channels and integrate them in ways that create an omnichannel experience and to address those tensions and to address those points of conflict and friction, that we're much more likely to get people to engage, and in getting them engaged, they're much more likely to keep engaged, and that the result is by engaging today, you reduce cost tomorrow, and you improve health tomorrow. And so I think that's probably one of the key learnings for us is to constantly think about what does that omni-channel experience looks like. And so don't get too fixated on telehealth for telehealth's sake, but how does telehealth actually work with these other channels of care and support to create a completely new experience for the consumer?
Yeah, just wanted to add one point to Marcus. Apart from multi-channel, it should be at a multi-time frame, meaning that they should not be constrained that I can only see the doctor from 8 to 5. It should be accessible at all the time as well.
I just like to add something that it's critical to remember that health is really still a very private matter for people. And there's been sort of a digital trust evolution over the past decade or two as it relates to things like the .com era, where for the first time consumers began making online purchases, and then over time digital experiences with a consumer goods company became more commonplace, and people began to share more of their personal information about themselves, whether knowingly or unknowingly, and that they then began using the companies then began using that information to delight the customer and really offer them other similar items, or an automatic renewing of a magazine subscription, or an automatic monthly delivery of your coffee that you like, or those kinds of things. And then sort of the next phase seemed to be the banking industry coming along with digital and leveraging digital engagement, earning our trust little by little, to the point where today it's probably very few people who ever visit a physical banking location or write a check and stick it in the mail. So right now, as it relates to healthcare, we're sort of in the midst of earning that consumer's digital trust. And it's not an overnight process. So providing deeply personal and satisfying interactions that, as we've all said, sort of exude that we care about you type of feeling, that digital empathy, we're making significant progress by doing that. And it's really about delivering the right solutions to the right consumers in the right medium at the right times for their lives.
Excellent.
Yeah, I might just share an example, which for me was, I learned a few lessons through this. And again, sort of within the context of COVID, we wanted to make sure that we were offering easy access to testing, throughout this process. And we sort of stood up this process from the ground up very, very quickly, where we partnered with one company to provide testing in the home, where we would, send a test kit. They could sort of give the sample, FedEx it back, And then on the other hand, also had a partnership with, sort of actually with Walmart for folks to come and do the drive-through testing through, any of, I think, 550 Walmart stores that we partnered with. And that experience was really, really interesting. It was, somebody coming in, going through a digital platform, checking their symptoms, and then making a choice around, did they want Humana to call them and provide any help? And then also looking at sort of what option were they going towards more, the home testing or the in-person testing? And again, our largest population is a Medicare Advantage population. And it was really interesting that the number of people who felt completely comfortable doing everything in the home and leaps and bounds sort of picking that process of getting the home testing kit. Now, of course, there are sort of health concerns that folks had as well that was prompting that. But then the other thing that we saw is that we went out of our way to offer, sort of support. And if you click this button, you'll get a call from Humana. And if you have any questions, we'll answer those for you and walk you through the process. We actually saw that as a barrier. People did not actually want to have that process of a call. They wanted essentially an end-to-end seamless digital process from when they first started to when they get the kit and send it back. And so for me, that's been an enormous lesson that we don't actually have to have all of the services that we're offering. We've engaged in partnerships that allow us to build that end-to-end delivery model. But that delivery model that's preferred, has been digital. And I think Amazon has sort of built the expectations that you don't necessarily have to have a person on the other side, and that's okay. So that's, I think a good lesson learned there.
That's excellent. And you actually used a word that I think is really important, and I'd like to move to next, which is barrier. Because we're talking about all these wonderful things, but there are a lot of barriers. And so I would actually come back to you, Barry, because I've known about Dakadu for a couple of years now. And when you joined, you were described as a big picture visionary guy. I know you have global health, but you've also got US startup experience. And so, when you think about the barriers that are in front of you and the barriers like Mona just spoke to, what do we need to be thinking about in terms of rolling out these strategies, being, realistic about barriers? You're on mute.
Sorry about that. I think there are a number of challenges that we see. Health insurers, for instance, digital integrated health engagement strategy, it really has to have the full leadership, C-suite, and board commitment and support. And what we've seen sometimes is that it has to be championed at the highest levels, aligned with the business strategy, and really contribute to a clear set of business outcomes for the organization. BlackRock, a company, did a survey in 2019 that actually revealed a challenge, and that's for the executives in many companies, especially the healthcare industry, in that 91% of the board members admitted that they, quote, had no knowledge at all of artificial intelligence or machine learning. Now, that helps to explain an uphill challenge that many health insurance executives and others face in securing that necessary support and funding to pursue the digital health engagement strategy for their organization. Another challenge is, and I think this has already been brought up, is I'll call it lack of integrated data or data being in silos. So I consistently hear from healthcare leaders that a big problem they're facing is that over the number of years that they've assembled their own non-integrated digital offerings, and you combine those with an assortment of different separate third-party point solution assets, and this has created numerous data silos that prevent them from conducting comprehensive analysis at the member level or the population level. So it's preventing them from taking kind of a holistic approach that can auto-generate timely reminders and messages, that can create recommendations that could be pushed out, and even triage identified people at risk into a care management program that that might be beneficial for them. So the insurer's non-integrated collection of this sort of siloed data that they've found themselves in prevents a kind of line of sight into which members are engaged in which offerings and which offerings are producing the desired results and which are not, which is equally important. Another belief that's out there is, of course, that it's sort of a preaching to the choir, that the only people that are going to come on board with well-being and preventive type digital offerings, no matter how attractive they might be, are those who are already relatively healthy. And that's actually not true. Many studies have shown that significant health improvements and cost savings can come from digital interventions with the less healthy populations as well. But let's say even if it were true, isn't that the exact cohort that a health insurer would want to be aggressively trying to recruit and create a loyal bond with, that healthy, health-conscious paying member who really is far less costly from both a clinical and an administrative standpoint? Another barrier or, I'll call it challenge, is that digital intensity. And Accenture actually has come up with a thing they call their digital intensity calculation that places a measure on a scale of 1 to 100 to the extent that how the customer uses or is impacted by their online, mobile, and social channels as part of their overall interaction along their consumer journey. And they've been able to show that as a consumer's digital intensity grows or increases, they're actually less likely to see much difference among health insurers, and therefore they're more likely to shop around. So, one approach might be, rather than segmenting a member population where historically or traditionally we might do that by health plan product or by age or by gender or by another traditional subset of information, maybe a health insurer would try categorizing current or prospective consumers by their level of digital intensity, rather than investing in a broad solution that assumes every digital consumer is the same.
Thank you. Does anyone else have something to add?
Yeah, I'll quickly make a point on that, Nicole. One is that one of the challenges is the point solution, meaning that we have a lot of solutions out there, but it just solves one problem. It is not a holistic tying it up together to give a business outcome. So we have seen that as one of the challenges. The second issue is about the solution not trying to replace an actor in the ecosystem, but trying to assist the actors, whether it is a physician or caregiver or therapist or counselor, to do their job at a much higher efficacy level. I think that positioning is also lacking where some of the solutions have failed. And very quickly, in 30 seconds, I'll say that we have implemented a solution in one of the counties for the mental health issue. After this, pandemic, we have seen a rise in 211 call where people need some mental assistance and therapies and those things. A simple digital solution on going through this multi-channel approach that Marcus was saying, it really unleashed the power of the digital, whereby to increase the number of folks who can be catered by the same number of resources. And also it reduces the emergency room as well as the prison admission for the county. So I think that tying the solution end to end to bring the holistic view, and also not trying to replace the actors, but trying to make them more efficient so that the efficacy of the entire system increase is the key for adoption.
I'd go even one step further on Jaffrey's point on that one, which is, I think one of the barriers is this kind of rigidity around some of the actors and the belief that they view some of the innovation that's occurring as fundamentally as bad to their role in the ecosystem. And I think about providers specifically, and some of the hesitancy that I've seen, for example, to have, I can't tell you how many times we've had customers come and tell us that they've attempted to share, for example, fitness tracker data off of Fitbits or Apple Watch with their doctors, and their doctors just sort of, I don't want it. It's a waste, right? And I think that is, probably a second point about kind of where valuable data is and isn't. But I do think that one of the barriers is this kind of rigidity in thinking about the, what is my purpose? If you're an actor in the system, what's your purpose and role? And that I often think that, that we kind of landed, and I'll pick on, doctors a little bit on this one, but of, the view, if you use a sports analogy, of being the quarterback. And I think maybe that's not what they should be in the new world. In the new world order of healthcare, maybe they should be the coach. Maybe they don't even be the coach. Maybe they're the general manager. And as I had somebody mention to me a number of years ago, the life expectancy of a general manager is way longer than a quarterback. General managers don't worry about their ACLs getting blown out. And so the point being, I think some of the barrier is this kind of view of what is your sort of function and purpose, and being willing to allow your function to be transformed to something different in the ecosystem. I think the second is just fundamentally around data, and it is back on the tracker data that, and I think I saw it in some of the Q&A, that I think there is a much broader data set that's out there that is much more informative about the health of people than the traditional healthcare data, than claims data, than data that's in clinical records in the EMR, than data that's even produced in lab data or whatever. You think about all the behavioral data that exists and what that's the story that really tells about your health, where you're at today, where you're going, where you've got health risk, where there are health issues. I think that's the other piece that is a barrier that increasingly the industry still has kind of fought a willingness to allow itself to be much more exposed to that broader data set. And then also recognizing that we as consumers don't, like, the data is irrelevant. It's the insights I care about. I don't want my health record. The conversation about health record is, if you gave me all my health data, I don't even know what I'd do with it. And I work in this industry. What I want is, what does the data in my record tell me I should do? What is the next best thing that I should do as an individual if my goal is to be a little bit healthier today than I was yesterday, and be a little bit healthier tomorrow than I would be today? Or what do I need to do for my kids? Or, how can I help my mom? And so I think about that, those being sort of barriers that we've got to figure out how to address.
Excellent. So I want to make sure we get to those questions. They're starting to add up. And there's a couple that I really love. I have one last question. It's kind of like a fire round here. So very quickly, I would ask each of you, what is the single most important thing for brand loyalty right now in your space? Mona, you want to go first?
Well, I think it's to solve problems that matter.
Okay.
Really.
Excellent. We'll come back to that. I see this in the questions. Jeffrey.
Yeah, it is knowing about the consumers and helping them really creates the.
I like this theme. Marcus?
I concur with those points. I'd also probably add, it's as our ex-CEO used to say, you get 1 point for talking about it and 9 points for doing it. And so I think it's action. I think it is actually not stop talking about it and just go out and do something.
Excellent. Barry.
I think the word that keeps coming to my mind is, and we've all said it, is trust. It's building that, trust with the consumer that then will in turn build loyalty. And you do that by, providing a fully integrated, member-centric digital health engagement platform that will draw consumers back time and time again, and really through, easy, thoughtful, caring, and deeply satisfying experiences each time.
Excellent. Well, that's a perfect segue to the first question here that's gotten the most votes. In public health, most of what I do is around human behavior and how people think and actually behave. So I'm in love with this question. It speaks to my heart. It's written very simply, just, can you explain how you go after discovering what people actually care about?
Yeah, I can go first. We have done a lot of consumer journeys. We use some advanced anthropology principles. We have hired a number of PhDs, and we rely on a techniques on asking a deeper whys. For everything, there is a bliss point and a pain point, what a consumer does. And there are things that are very intuitive, things which are not. So the philosophy that we use, it's a very well documented, it was, I mean, invented in Netherlands, called Design for Happiness, to discover a deeper whys that what a consumer need by forming a right cohort of resource. Like we have done these journeys for Medicare conversions from commercial to Medicare, the person going through this entire cycle. What are the pain points and bliss points that they get? Now, this is very painstaking process. We have done it for the outpatient settings, for the provider settings, but asking those deeper whys really gives you the answer that what the consumer needs. And that's what we use. Sorry, it went slightly longer.
Yeah, I'd actually tell you that there's two. Our methodology is probably a little simpler. There's two pieces. It's ask and witness. And ask means actually ask people what they care about. Don't say, ask the question, what do you care about? What matters to you? Don't say, do you care about this? Do you care about that? But instead say, what is it that you care about? And let people tell you, because they will tell you. I think the other piece on the witness is sometimes we don't always want to express fully what we care about. Some of those things, maybe there is some sort of subconscious, unconscious driver for what we care about. Maybe it's something that we don't entirely kind of expose ourselves. And so the witness piece is actually watch what people do. Like that I'm sort of mindful that I've done this since I've come to Walmart every year. I go put on a white V-neck t-shirt and blue jeans and sit on a bench in our store and watch people roll into the pharmacy and just see what they do and see like what they seem to like and what drives them nuts. And I've learned more from that than I have any traditional consumer insight process, to be honest with you. And so I think there's a lot of, and so I think about the processes that certainly a lot of design folks like IDEO and Frog use around that kind of witness approach that I think is critically important that we often just miss.
I can add to what Marcus is saying really about the personalization. It's really critical to be able to meet a person where they are and with what they're interested in. It's great to say, to somebody that, well, you should quit smoking, but they might not be ready to do that. But they are ready perhaps to engage in some better nutritional habits or to start walking more. So meeting them where they're at with the tools and the resources that can help them, that's really how you engage them. Our digital coach really helps to continue that conversation and sort of drip out questions continually throughout the course of a year for an individual to respond, and therefore the machine learning that takes place gets to know that individual better and better and can continually personalize what it is that the person will receive or what reminder they'll get or what invitation into a certain program that might be, meet their needs that they're showing an interest in.
Yeah, so I would just say, I think most of us don't want to think about our healthcare until we have to think about our healthcare, right? And so how do you make this fit into your life? I think that has to be really the ultimate sort of principle. I'll say I'm in awe of our experience and design teams because their ability to just generate phenomenal insights into the process and how we tailor the process to be much more consumer centric has been, I just don't know how we would design without them. And I think there are two pieces of it, right? There's one, what is it that you need to build? And then the other piece is, what do you need to stop doing, right? What are the friction points that we unintentionally sort of put into the process and maybe more so from a payer perspective, because there are things that we have to do, right? And so, how do you care for and understand kind of both what you do and what you need to stop doing? We actually, I'm 8 months into Humana, and so, still learning the organization, but we do have sort of this field hours that we have folks do across the organization, right? To Marcus's point, getting outside the building, really, sitting down and being in the call centers and listening to the calls that are coming in. What are people actually saying they need? And I think there are just tremendous learnings that anticipated and unanticipated that come out of that. So it's just so important. And then the last thing I would say is, you know, this, I think it's really, really important to get out of your particular perspective and the side and the perspective that you bring to a question, and how do we take a really multidisciplinary approach to solving those problems. I think there's a lot of power in doing that.
Yeah, and to your point, Mona, it goes back to the very first answer you gave, talking about often it could be housing insecurity. It could be food. There's a lot at play. And to Marcus's point, you've got to witness. You know, oftentimes people aren't just going to come out and tell you. They may not even realize that's what's really the core of the problem. So we have time for one, maybe two questions, depending on how quick we are. This one is straightforward. How do you define and measure loyalty in healthcare? Mona, I'll pick on you because I can hear you.
Well, I mean, I think a lot of folks on the Medicare side of the house would say, you know, we get to see it every year based on who re-enrolls, right? There's an active choice that people make to whether to come back to Humana or not. And so there's that sort of, that's one piece. But we absolutely, I think the organization has been immensely focused on patient experience scores, right? How are we doing on NPS measures? And so we are tracking that in sort of every aspect of how a member engages with us.
And I mean, I think, I mean, this may sound a little vanilla, but I think the NPS comment is spot on. I think we use NPS as a basis as well. But I think I want to, but really dive into why that really represents loyalty, because what it really says to somebody is is your experience with me so significant and positive enough that you're willing to tell your friends and your neighbors and your family that they should also go engage in that same experience and be a part of it, and that you're excited enough and proud enough about it that you want to go get other people involved. And so I think for us, that really is where kind of the essence of loyalty tends to exist, is that sort of desire to say, it's not just do you stick with me, but do you actually want to get other people to come in too? And I think that's where I think the deepest loyalty exists.
Barry, did you have something to add?
I think Marcus is spot on, and Mona as well. I think that, you know, when you can create, I've heard it said, you know, evangelists for your organization or for your product, that's really the sign that you've hit a home run in terms of customer loyalty.
Excellent. Okay, we've got a couple minutes left, so I'm going to combine a couple questions here. Let's see if I can do this well. So putting these together, it's sort of, you know, what matters to people is far more important than what's the matter with people. We've talked a little bit about that. You know, clinical data won't be enough to get us there. Can you talk about how retail consumer insights can help deliver what really matters to people? And someone said, it seems like Walmart's posed well to do this.
Yeah, I mean, I answer that kind of quickly in two ways. I think one is by helping identify, I think, where, you know, it is about illuminating those things that people care the most about, so that, to Barry's point about personalization and other, you know, that is what really then enables you to say, okay, it's not just what should I be speaking to you about? What do you care about? What are you interested in, as Mona mentioned, but it's also, how should I talk to you about it? And what's the way that you're going to find that's going to make you the most comfortable and engaged? I'd also go one further, and I think what that data also, what I believe is, and I will acknowledge I'm an advocate of big data. I believe I think that the way we act, what we search for on Google, what we like on Facebook, what we watch on Netflix, what we buy in Walmart, tells a much bigger story and than we realize, and that our system is sort of representing itself through those actions. And so I actually do think there are opportunities in that behavioral data as well to start to identify health issues and health risks that people don't even know about. That, you know, can you identify, you know, you've seen Microsoft through search, through some of their research show that mining search data, you could identify individuals with early onset of cancer based on their search behaviors. I mean, that's where I think there's also enormous promise. And so I think our ability to unlock that is gives us a way to really start to engage people much earlier in a much more preventative way in their health, which ultimately leads to better results.
Excellent. I see you nodding along, Barry. Do you have something to close us out?
I was just only thinking to myself that, that trust chasm that we all need to sort of solve for is, how do we earn in this, data intensive world we live in, and the thought and sometimes fear that everybody all these organizations know more about me than I know about me, or certainly more than I want them to know about me. We're still not quite there yet, I think, in the healthcare industry, and earning that trust where the consumer is really at ease in being very, very forthcoming with virtually anything that you'd want to know about them. But I think that chasm and crossing that, we're getting very close.
It's a very important closing thought about trust. So I just want to say thank you to all of the panelists. I'm sure you saw I was taking notes the entire time. So I was both here and sort of as an observer. And there are still many questions in the queue. So I encourage everyone to reach out. I know, everyone on this panel can be found on LinkedIn and other places. You know what organizations they're affiliated with. So please keep the conversation going, because there's some wonderful questions here. And, thanks to the health team. I hear there are puppies. Is that right? We all have to stay for the puppies. So I'll hand it back over to the health team to take us to the post activity.
Thank you, Nicole, and to all of our panelists. If you'd like to continue the conversation, please join us on Twitter. And now, please welcome Danielle and her cast of amazing canines.
All right, we have double check our running order here. Now our next dog is actually Quinn's half brother, half older brother that is, and his name is AWOL. And we always like to do the joke because AWOL is older. Remember, if you go AWOL, you get thrown in the bridge. We think we're funny, but between Ashley and I, we have lots and lots of dogs. Now, like I said, AWOL is a 4-year-old Dutch Shepherd, so he's pretty much the same breed as Brady. He's just a different color. He is what's called a black Brendel, and he's an absolutely gorgeous dog. I've had him since he's a puppy, and his personal best is right around 17 to 18 feet. And many of you did see him in the first webinar, and he was the one who was holding the jump rope for Legend. Let's give my big man AWOL Stewart a nice warm welcome. AWOL, over here. Always. You got a bumper for me? Okay. I'm gonna give AWOL just a little what, Greg? About 21 feet? Give or take, or a little bit shorter. I think it's around 21 feet. Now, she is actually Legend's mother, so she's, of course, very, very cute. And not only does she love to dock dive, but she's also a really awesome frisbee dog, a really cool trick dog, and even likes to dabble in a little bit of agility and herding. We're going to give Ashley just a minute to get her in, but I'll go ahead and answer just a couple of questions that we usually get when it comes to the pool. A lot of people ask how high the dock is off the pool. The pool and the dock are about 2 feet. It's 2 feet from where I'm standing to the top of the water. Most dogs start off in on the ramp and they get used to that and they transition themselves onto the dock. Now this is Michigan, everybody. Like I said, let's give her a nice warm welcome. Now that we got her wet, we're going to back her up on the dock. We're going to back her up on the dock and see how far she wants to jump. I'm going to have Ashley hold her as well. Right, go. Okay, Mama. Come on, Mish. Mish, you ready? Set. Go. Go, go, go. Nice. That was around 13 feet 6 inches, give or take. It's hard to judge and to throw. Come on, pretty girl. We're going to do one more. Let's see if we can jump even bigger. Is that your bumper? Come on, pretty girl. All right, sweet girl. All right, come on, Michigan. Ready? And go, 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 go. Nice. About 13 feet on that one. Very good job. Now you can tell this is a little bit of an inconsistent jumper, but she still has lots of fun, and that's all that matters.
Hey, come here.
Oh. Woo! Like, stop moving. Do you want this bumper? Okay. Okay, guys, you got you warmed up on some of our medium distance jumpers. Now it's time to bring out the big boys. These next two dogs are both black. One's a black lab, one's a black shepherd. The first one is actually Ashley's dog. And we're not sure quite where he came from. She did pick him up from a local rescue. We're not sure if, I think she got him at a shelter, so we're not sure if he was on her springer or if he was a stray. But he definitely did not have a lot of training when she had him. She just got this dog about 3 months ago. So since then, he's already learned how to dock dive, he's learning agility, and he's learning lots of fun manners, which for a lab can be a struggle. He's a 2-year-old black lab. Let's give a nice warm welcome for Trigger, everybody. Hi, Trig. You ready?
Come on, buddy.
What? Hey. Hey, you want to walk the dog?
Go.
Goofball.
Now, come on, buddy.
All right, come on, Trig. Now, I'm holding, correct? Okay, I'm going to hold the big man. He's going to start talking to us now, folks. Now, on a full-size dog, he does jump in the 20s, so we're going to see just how big he wants to jump today. Now, I'm going to hope that I don't fall down. Oh, buddy. All right.
Ready?
Actually, we're going to have to kind of see where he jumps to, okay? All right.
Ready? Ready? Go, buddy, go, buddy, go, buddy, go! Woo!
Nice jump there. What's that? 19 is. Very nice job, bud.
Come on, buddy.
Yeah, it's a lot about the throw, everybody. Not always about desire to jump, but we've got to get our throw correct as well. Come on, Lobos. Doc, no, come on, what? 60 seconds?
Good job, buddy, all right?
As you can tell, Trevor does not like the dog. Not at all. All right, guys. Let me see what's good. All right, guys. One of the last two dogs is going to be our black German Shepherd named Anvil. Now, he's actually my husband's dog, but since he's behind the camera, I decided to go ahead and run with him. Now, he's a retired DOD dog. That means he was at the Department of Defense for a little while. And then he didn't work out, so we went ahead and adopted him. But before we got him, he had about 3 different homes. He's kind of big and crazy. But you know what? Every mother loves their children. That's what I tell him all the time. He's big, he's crazy. He has to have a special kennel because he likes to break out and go visit everybody. But he absolutely loves the pool, and he loves to give hugs, even though sometimes a big slobbery kiss comes along with it. Now, his personal best is about 25 to 26 feet, but that's with a full-size dog. I think in this pool, I think his personal best was, what, Greg, about 20? 22? 22 is his personal best. I don't understand why you're trying to walk it. 22 is his personal best in this pool. Now, we're not going to do a warm-up with Anvil, just because he tends, no, don't do that, you're making me fall wet. Just because he tends, ouch. He tends to do best and he's not warmed up. Like I said, big and crazy. He's the proverbial bull in the china shop. You all right there? You good? Okay. All right. Okay, guys, let's wish Ashley luck that he doesn't pull her down the dock into the water. All right, Angel, are you ready, buddy? Up here, buddy. Look up here. Look up here. You gonna get it? You gonna get it, Angel? Come on, buddy. Come on, buddy. You ready? You ready, Angel? You ready? You ready? Set, go! Go, go, go! Big jump there. Very nice. What was about that, Greg?
20.
About 20? Okay. That's about 19 or 20 feet. Now, the fun part about Angel is getting a toy away. Come on, Angel. Angel. No. You got it? If you will pull it, ask him to go. Come on, bud, you ready? You're gonna get it. You're gonna get it. You ready? You ready? Set. Go, 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 go. There's a big jump there. Another 19-footer. Let's give him a big round of applause. Very nice job, bud. Oh, no, you're not. Primo. He's like, hi, Dad. Okay. We almost got him. All right, just get that second one. He's going. Okay, everybody. You're got it. Okay, everybody. We have definitely saved the most exciting for last. This next dog can be a little bit scary. Good thing you folks are all the way through the world the World Wide Web and are in the same room. He strikes fear in the hearts of lots and lots of people. His nickname is the Warrior. His best friends, the ones he beats up on, are Anvil and AWOL. So he's definitely a force to be reckoned with. He is nearly 3 years old and just learned to dog dive, and you guys are in for a special treat. Now, I'm gonna grab him just to make sure that Ashley stays safe. kid. He's the sweetest dog in the world. He is a 3-year-old little Papillon mix, and while he's only 10 pounds and 12 inches tall, trust me, his attitude makes up for it. And he only will retrieve a big dog's toy. Let's get wet real quick. Ready? Go. Sorry, Greg. And yes, that toy is bigger than him, folks. All right, buddy. You want to jump off the dock like a big dog? Come on, bud. Come on. Now, don't worry. He's not jumping 20 feet. He's only about jumping about 18 inches, but when you're 10 pounds and 12 inches tall, you ready? You gonna get it? Go! Very nice job, Wombat. We're gonna show you guys that one more time. Need help? I'm coming. Big dog doesn't need help out of the pool, I guess. One more jump. One more jump. Come on. Hold on. Wait, ready? Come on. Ready? Go! Good job there! Let's give Wombat and all of our dogs at Team Zoo Canine Entertainment a big round of applause. If you do have your favorite, please let me know. Oh, I'm coming. That's fine. If you do have a favorite, please let me know on my Facebook, Team Zoo Canine Entertainment. And also, this is my other company, Splasher Cup, that we actually use in the pool. Well, folks, you have a great day. Enjoy the rest of your week. And once again, Health, thank you very much for having us join your webinar. Bye, folks.
Thanks, everyone. Have a great rest of your day.